automatically refer medical requests to other health facilities within the list of medical service providers where medical doctors determined or recommended. There is the lengthy procedures in pre-authorization. And again, you can, Chair, when you look at this, we are talking about 10 minutes. For discharge, 3 hours, all the way up to uploading of dependents within 6 hours. 5, inadequate cover on preterm and premature babies. And this was fully addressed. Further, the Commission has enhanced all the benefit structure as shown, I think, in Table 1. Use of one-time PIN, that is OTP, for verification. The consortium members of any of the contracted service providers are to employ the biometric identification system, the main member identification tool. Further, registration under the biometric platform will be continuous throughout the contract period to ensure that all teachers access the medical cover. And so the use of biometric platform is to ensure all those points there up to number 5. And the last point here is different amounts charged as Copay. Commission negotiated a fixed amount of 100 shillings as a Copay outpatient visit per individual for dental, optical, and specialist doctor for consultation services. The Copay, however, is not charged on outpatient hospital visits for medical services, repeat visits for services within 14 days from the date of the previous visit, and when picking medication for chronic conditions which does not require consultation with the doctor. So, Chair, then at Appendix 1, you can see comparison between the previous benefits of the contract and the current ones and the teacher's dependents. And I think, Chair, that's it on the medical cover.
Thank you. Maybe you clarify what's Copay. Maybe some of us don't understand what is Copay.
Chair, with your indulgence, I have my colleagues here who will help me with some of these issues. I don't know whether it is Choge.
Yes, Copay is what?
Okay, thank you, Chair. Copay is the payment you make when you visit the hospital. You know already you are under cover, but you are required to make another payment before you are treated as part of the contribution to that treatment. It's only a small amount of 100 shillings.
So I pay, yet I'm covered. Cash.
Yes, you pay cash.
So what's the reason, maybe?
Chair, before maybe even Choge goes, what it is about is that it is also to help the teacher. Sometimes teachers will make repeat visits to these hospitals. Today you have a cough, tomorrow you are sneezing, and because you have a cover, you don't even remember that you have a limit. So to make sure that the teachers do not exhaust their allocations, just making busy visits to the hospitals. If you are not sick, then that actually 100 is just like a deterrent. Yes.
So thank you so much. And I want to open, before I open the floor, I have a number of questions. First of all, this is actually a very, very important cover for teachers. But CEO, you need to note that we have a lot of outcry out there. I'm glad you've indicated the 7-day, but a number of teachers out there were told, if you are sick, don't come back until the lapse of 7 days. I'm glad you have elaborated that, because if I'm sick today, I'll be sick for a whole week. You are telling me wait until the 7th day when somebody will have died. That is very, very, very unfortunate. But the real thing that we need and want to understand is the medical contract. I think we really need to look into it and then get to understand, because the teachers that we represent, and they are the teachers of this republic, wanted to know what are the terms of the contract, how was it entered, how is it beneficial to them, how is it assisting them, how is it making sure that the teaching learning process is actually being done well. So it will be prudent, maybe later on, if you don't have it, you will provide this committee with the contract, how you entered and how it was done, and we will be able to look into it. Thank you. Let me open the floor. Let's have 4 rounds of questions, then the last one, and then we move to the next one. Let me start with the Honorable Nabi. Just 2 questions, Honorable Member, and then Honorable Member for Nyamira, and then Honorable Professor.
Thank you, Chair.
Yes. I'll request that you note down the questions. Yes.
Thank you, CEO, for a very elaborate run-through. Question 1. From where you sit, do you think this scheme is working and is benefiting the teacher? Second question, who is Bliss and why the preferential treatment that everybody must be referred by Bliss?
Thank you, Chair. Chair, mine is also on the same, on Bliss. Did the Teacher Service Commission do due diligence to ensure that this Bliss offers the right services to teachers? Because the complaint out there is that it has no proper medication. Number 2, is TSC aware that teachers do not go to hospitals when they are going for referral? Like, for example, Tenwek Hospital, for teachers who come from my place, if you are not attended in the Bliss, you can then go to Tenwek on referral because that's the best hospital around that area. But looking at the policy TSC has said, all the best hospitals like Nairobi West and all that have been removed from the medical cover. So where do you want these teachers to go to get proper medication?
Thank you.
And then finally, Chair, I also have a problem with this Copay. Because when you tell a teacher, you know, yours is to provide a medical cover. Why should you tell a teacher to pay 100 shillings when this medical cover is supposed to cover for the teacher?
Thank you. Yes, a member for Nyamira.
Thank you, Chair. Mine starts from the allocation of 14 billion, whereby the National Hospital Insurance Fund said that the money was not enough when they were requested to be the bidders, and then they gave theirs, which is which had a difference of around 24 billion. What is this which is good in NHF, which made them to be higher than the one that you have given a tender, which is not giving proper services to the teachers? Because out there, teachers are crying, the services are not adequate. What is this that you evaded? Maybe you could have gone, you could have even come to this committee so that with us, we could plead with the Treasury to give the money which was missing. Maybe what is this? Maybe you can be able to tell us.
Thank you, Honorable Professor.
Thank you, Chair. I have 2 questions. One, now that this contract was given and the receiver of the teacher is not enjoying the service as required, I am happy because when the CEO was presenting, she said that when the teachers are not properly served, the contract can be terminated. Then what I'm asking, then can we now terminate this contract and get another service provider now that it is not serving the purpose? The second question is, when you tell a teacher to pay 100 shillings because you feel that this to deter the teacher from coming back many times, that is criminalizing that process, because we are talking about a teacher, not a student, and a teacher who has been trained and they know they have a job description, they know what is required of them. It is an unfounded claim to believe that a teacher has to pay 100 shillings so that this teacher doesn't have to come back many times. I would wish that fee is stopped with immediate effect. Another...
2 questions?
Okay.
Yeah, 2 questions, yes. Let me just have another round because the questions are few. Let me start from Honorable Member for Marakwet West. come to Orero, then we come Honorable Member for Julius, and then Honorable Njendi.
Okay, thank you, Chair. Madam CEO, on 26th of May 2022, the Commission wrote to NHIF to provide a medical cover, a comprehensive medical cover. The same was rejected because the amount quoted was not available. Now, you went ahead to advertise public bidding. And you did the same, you advertised for 3 financial years from 2022 to 2025. Now the question is this: why did you proceed to advertise a tender, which is a private medical cover, for 3 years, yet you would have requested for the same amount in the financial year 2023-2024, so that Treasury can allocate the amount if it is available, instead of locking teachers for a cover that they are not proud of for 3 years, 2022 to 2025. Number 2, the cover by Minet. I don't know whether you are aware that most hospitals treat it as second tier, as a second tier cover, because a pre-authorization that may take up to 3 days is required from the insurance company so that a teacher who is even in a critical condition can be treated. What measures are you taking in place to ensure that the pre-authorization takes the shortest time possible?
I think I was a victim when I was a teacher. I had gone one time to the police hospital, and when I was there, I was told that I can only come back after 7 days. But now, today, I've realized that they have removed it, and I hope that all the hospitals will follow that, because some also still believe that they have to take 7 days. So please, can you give instructions to all the hospitals that treat teachers that they are treated every time they go to those hospitals? 2, those who undergo operations are never authorized. So can you investigate from your end that the teachers who go for operations are allowed to be operated? Most hospitals, they do not agree that those teachers are operated. Thank you.
Thank you, Chair. Mine is basically on Minet and the entire spectrum of the medical cover. Minet, in 2015, it won the tender to provide the medical care for the teachers of this country. There has been issues with teachers concerning pre-authorization and the entire scheme. And if you look at it, Minet will be still the steward of this scheme up to 2025. What is this that informs the entire system that whenever there is a tender every year, Minet qualifies again to provide? The other issue that I want to raise is that on pre-authorization, teachers have really suffered. I am perturbed by the statement that it will take 10 minutes to qualify for pre-authorization so that teachers can be attended. That bit is wholly not happening when teachers are going to hospitals to receive services. However, the issue that I want to raise more is on the way the different diseases are given attention. For example, I would like to ask the Commission today, the teachers who are being employed in this country, most of them have stayed outside without being employed. And most of them, the issue of maternity has a lot of money that is given to that care. And it is just a small percentage of teachers of this country who are going to hospitals for maternity care. This is where 75% of the money allocated to that kind of a section, 75% of the money is not consumed. As an executive secretary, a member of the National Executive Council, Kenya National Union of Teachers before, we have searched to the providers at the county level. When you interrogate the usage, you realize that 75% of the money given under maternity care is not consumed because teachers are entering service when they are not even going for maternity because of suffering that they are getting in this country. So why can't you channel that money to other areas where they need a lot? Why do you take a lot of money, or maybe it's an arrangement? That the money should be channeled to other areas where it can be consumed effectively.
Thank you. Let me just, Honorable Njendi.
No, it's an observation.
That's very good.
So, Chairman, mine is almost related to, one of them is related to what I teach. I'm just curious. For example, here in Parliament, medical cover is taken up just annually, so that if there are issues, you can do away with it so easily. Why did TSC decide to have a medical cover for 3 years, not 1 year, as other organizations are doing? My other question is on rates of payments for inpatient, outpatient, dental, optica. Now I'm seeing, in my opinion, a teacher is just a teacher, in my opinion. This is qualified by your last expense, that these teachers, each last expense is 300,000. How come when it comes to inpatient, the teachers are considered differently when it comes to payment? And just a teacher like another teacher. I see even when it comes to maternity, which my brother is talking about, from teacher number level 5 to level C5, which is 10, the rates are the same. Why not make these rates the same for all teachers, just like you've done for last expense? Thank you.
Thank you. I think, CEO, I think you need to note that even when we normally go to our constituencies, we meet teachers asking very pertinent questions. And the pertinent question is this issue of Copay. I really want to really talk on it, because if a teacher has been insured and is supposed, he knows the limit, even here in Parliament. We know the parliamentary limit is about so much. If the limit is over, it is over. So why are you actually charging these teachers extra? Actually, I think that is actually something which is not good in this contract, among many others that we shall see in the main contract. 2, we have this very important issue of hospitals. That one group of hospitals are trying to elbow everybody out so that they remain alone in the scheme. This is actually not right, and I think this is something that this committee is not trying to wish under. We really want to see each and every hospital that is able to provide the service be given the opportunity to provide. But where a consortium tries to elbow each and every hospital out, even if they are providing very good services, you need the missionary hospital in Tenwek, for example, serving the Southern Rift. From Narok, from all those other parts of Kericho and Bomet, they should be actually done very well. You really need to give us the details on how the vetting of the hospitals was done, how was it arrived at, and actually to know that the input of the officers, especially the teachers. We've heard the teachers in the field there saying that we have 1 or 2 issues. Can you be able to give us, before you look into the issue, the limitations, what were the feedback of the teachers out there? What were they telling you how to improve this? Are you able to really list it down and tell us what's supposed to happen? So please answer those questions, then we have one round and then we proceed.
Thank you, and I think I'll leave it to my colleague first. I want to say that the issue of Copay is a standard practice. Even in a HIF, you have Copay. Even as in the Secretariat, we have Copay. It is a standard. What we did is actually negotiate to have the teachers pay. Usually it is at 500, but we negotiated for the teachers to have at 100. It is a standard practice with all these.
Point of order. CEO, when you're talking of standard practice, is it for TSC or for everyone? Because me, I don't pay anything when I walk in the hospital.
You are a state officer, Mheshimiwa, but check even with NHIF. Even if we had taken this, and Chair, allow us, please, to first respond. I know you'll give them honor. Even if we had taken them to NHIF, there is still Copay. It is a standard practice in the insurance industry. Even as in the Secretariat, we have an insurance scheme. We still have Copay. And then, Chair, I will give my colleague, and I think there are too many questions on the medical scheme, which I think would need us to come here to just prosecute on the medical scheme alone. Because I think we need to take you through this medical scheme. For the TSC mostly touches on the procurement. And because of the number of teachers we have, that is why we have a broker to manage this scheme. We tried it the first year and we failed hopelessly. Then we saw that we couldn't give services that we are supposed to give to the teachers. We were just dwelling on the medical scheme, and that's why we got this brokerage. And therefore, Chair, we will answer what we have asked, but I am asking for your indulgence. You invite us here, and TSC can come accompanied by Minet, because some of the questions you're asking actually now fall on Minet, because they broker for us, including the hospitals that we are talking about. Of course, as we were signing, we were advised by the Attorney General to ensure that all hospitals were included. And we can come with that list so that members can therefore check when we said what the document first about the hospitals they are talking about. Because before we signed that contract, we were told by the AG to ensure all the hospitals were there to cover for all the counties. But you will notice, Chair, that in some counties are well endowed with hospitals. Some are not, and therefore you find a bit of suffering for some teachers in those counties, and the TSC, neither the TSC nor the Minet now can do anything. But we try to include all of them. And therefore, Chair, what I'm saying, because we tried to kind of summarize, it is quite, this contract is huge because of our numbers. We are requesting that you allow us to answer these questions, but if the members want to understand this medical scheme, including the benefit structure, including everything there so that they can then converse, then we can be invited again. Chair, I also want to be on record saying that we tried to ask for money from this committee so that we could take our teachers to NHIF. It's not that it's just because teachers really wanted to go to NHIF. And it's good sometimes to listen to your clients. And therefore, we came to this committee. But again, the money was not available. And we were told by the National Treasury to advertise. So we advertise. And I want to assure the committee that it's not always that Minet must get it. It's the tendering process, which was above board. And I mean, every institution in this country concerned with the procurement and everything, including the AG, did now advise that it had been done overboard. So what were we to do as Teacher Service Commission? Then secondly, the tendering process is quite an arduous task, and considering our numbers again and what we do. So this is a framed contract to save on time for the Commission. However, if you listened to my summary, I said it is 3 years, yes, just to save time for us, if it works. But annually, it must be appraised. And members, you are our oversight. If after this year it doesn't work, we terminate it. And there is that caveat. That's how to get this this medical scheme working. It is terminatable at the end of each year, Chair. Then about Bliss, before Choge comes in, I did read that if you check, I don't know it is number what in my summary, I think what members are raising is what used to happen in the past. Before then, we did a survey and we signed this contract. If you check, I think my document, appendix 1, page 3, page 6. Okay, let us read the paragraph. If you look at page 6, Roman 3, mandatory referral from Bliss. that one we said no. So you can't be recommended by any doctor and by any hospital. And this is what is happening. And that's why I'm saying, Chair, I can appear here now so that I bring that contract, the signed contract. All these things are included. So I'll give Choge if I have left anything so that he talks about it.
So thank you, Chair. I think the CEO has covered most of the issues. I just wanted to clarify one or two things. Number one is that the medical cover is an hybrid cover. It has both components of insurance and capitation. Now, you will realize, and the question was asked, who is police? Police is actually the master capitator. The success of a capitation model lies in the capitator having a contract with hospitals and agreeing on the cost of treatment. For example, the treatment for malaria, the capitator must agree with the hospitals that they will treat malaria with this amount. So that arrangement makes the cost of this scheme slightly lower. If you are to go for full insurance, the cost of this contract would be much higher. So that's just what I wanted to clarify. There are some components in this contract that are insurance, some components are capitation. And that's why you are seeing police is taking a central role, because they are the capitators. The idea is that you must have, and during the evaluation of the contract, we must see contracts with the hospitals, that hospitals have agreed with your costing model for all the ailments that may come about, so that it's a bit much cheaper. That is understanding. For police, we did, during the evaluation, enough due diligence. I think the question was asked whether we did enough due diligence. We did enough due diligence, including requesting them to give us a list of all the doctors and their qualifications, all the clinical officers, and their medical facilities, whether they have drugs or they don't have drugs. So there was enough due diligence done during the evaluation process. I think an honorable member asked why we did not wait for NHIF. I think the contract was ending in 31st of October. So we needed to get a new contract from November. So there was no time to wait for additional money to be given. Although we had done that process, we had actually written to Treasury to request for the additional 8 billion, but the money did not come. So we had to continue with the process, because teachers need to be covered. Immediately the other contract lapsed. So that is why we did that. I think the issue of why are we doing it for 3 years, I think the CEO has answered that. There is a provision in the contract that if the providers do not meet the standards, that contract can be terminated after 1 year. So there is leeway to terminate this contract if there are enough complaints and there are enough grounds for the contract to be terminated. I think Copay, it was explained why Copay, and the idea of Copay, we said, was we don't want teachers to be going to hospital and then they exhaust their medical cover for small ailments. If you can buy Panadol, you should be able to buy Panadol with 20 shillings instead of going to hospital if it is not a big issue. But this is the Copay has been there in this contract since we started, so it's not a new thing that is being introduced. I think That is all I can respond to. Thank you, Chair.
Yeah, sorry, there was the issue of maternity, which I think he hasn't covered. And one, when you look at our data, the female teachers are more. So actually, I want to say that we should have this. And being a woman, I know that women really need this, and it benefits both the lady teacher and the husband, including those who are single. And therefore, I think it is not too much to give these mothers this money, because that's what also our data shows, and it benefits both. About this contract, it is on the TSC website as per the law. You can also get it on the portal of the PPRA, also as per the regulations. So, and that's why I'm saying that if you think fit to do so, we can appear and take you through this, through the contract.
The question I raised on when it comes to last expense, you equalize all the teachers. When it comes to payments for different levels, you...
Yes, I think you understand that. The teacher in D5, the lowest.
Yes, the lowest gets
and
different.
Then the highest teacher is insured differently. Yes, that's what we are saying.
Okay, Choge will handle that, but you know, when it comes to last respects, Honorable Chair, it's just that. I mean, we die. I don't, the same death. I know, I don't know how to explain it better, but you understand what I'm saying, Honorable Chair. But when it comes now to the rest of the job groups, maybe Choge can explain why it is segregated as such.
Yeah, thank you, Chair. I think maybe this is something that we have carried over the years, that we segregate our employees based on their job groups. But again, the issue also has to do with the cost. There are more teachers on the lower side of the job group than on the higher side. So if you equalize the medical cover, then you are likely to pay more than if you had that. And then again, the medical allowance, that's why the medical allowance was also segregating. And you know, this was a conversion from the medical allowance that was being paid. So the lower job group teachers were earning less. The higher job group teachers were earning more. So we have just moved along the same lines. But you know, that's something that maybe...
So you actually pick the money from the teacher, the lower earner gets less medical cover, the higher earner has a higher medical cover. But on this case of sickness, how do you cover it then? Because they are sick the same. There is no one who is in a higher job group having better disease or a lesser disease than the lower job group. So you need to have something to address this. I think that
for example, Chairman, you said the capitalized, he says he negotiates for malaria. A malaria ailment, for me as a principal of a high school or chief principal and just a mere teacher, is malaria.
Chair, we are getting, Chair, and I think these are things that must be changed right from the public, the way we treat the public servants. Because you see, even house allowance is different. So when you now take the allowance, the lowest teacher was paid differently and so on and graduated. I think some of these things, I think some of these things, even in the other public institutions, this is what happens. But we are getting, I think these are things that now must be looked differently. And as our oversight, I think some of these will help us in the recommendations that you make. Because we are a public institution and we have just carried over practices from the past. And it is not only in TSC, Chair, it is everywhere. And also look, and... Oh, my lawyer is telling me, can I say what you're saying? That even the speaker has a better car. But the issue is, Chair, that's on a light note, that actually these are issues we have carried on from our colonial masters, and maybe this is the time to change in the public sector.
I think so that we have a lot of issues to handle, members. I think this is something that we have raised as a red flag. We want the commission to, the secretary to know that in this insurance cover, let the teachers be covered equally. Look at it. Because sickness is never desegregated. Does not desegregate. A teacher who entered the service yesterday will be sick like the same as a teacher in job group, you are saying D something, is it? The chief principal. So this should actually not be an issue. And I think because your cover is renewable annually, one of the demands that we need to make is that let this thing be made the same for all the officers, so that we move forward. Can we go to this? Are you through with the questions first? I want the earlier questions. Are you through with them?
Yes, we think, Chair, we are, but we can be reminded because we took too many. But
Any
Chair,
other question?
Chair,
follow up.
it is my considered opinion that we have not exhausted. We can give them.
What is it?
I'm proposing that we give them time, go prepare, and come and convince us. We are not seriously convinced on this.
Chair.
Yes,
a follow-up.
For me, I just wanted some clarification on the master capitator, please. Did we have a tender for that, for us to select who the capitator will be? Number two, you're saying the master capitator negotiates for price. Can we know what percentage does this save you on cost vis-a-vis the cost of paying the capitator? Because we may be saying we are saving 10%, whereas we are paying the capitator 15%. So we are losing money while we are thinking we are saving money. Can we know the difference?
Any other question?
Follow up.
First of all, let's be so that we don't lose track. I know that. Are we through with the early questions?
No, not yet, Chair.
Not yet. Yes,
My chair was not a question.
Honorable member for.
Yes, Chair. I have a follow-up question on the contract.
Yes. Then you, and then we come.
Chair, this is a follow-up question on the contract, the 3-year contract, 2022 to 2025. If you read the report, Appendix 1, page 3.4, it is clear that the contract was signed as from 1st December 2022 to 31st November 2025. And the amount paid in that report is 53,580,306,270 shillings. So meaning that contract has already been signed for a period of 3 years. How can that be terminated, yet the contract has already been signed and the money amounting to 53 billion has already been paid? It is not true, Chair, that that contract is terminatable. It is impossible to terminate because the money has already been paid and has been committed to that service.
Yes, the last one, if you, it's a follow-up question?
Yes.
Under Bonabi.
Yes, Chair.
I want us to be orderly members.
Yes, Chair. I asked a very simple question from where TSC sits, and I insist on this, Chair. Do they think this scheme is working? And I'm asking that, Chair, because they get feedback.
Thank you.
And my second part of that is on that police issue.
Is it a new question?
No, it's a follow-up question to the police answer
yes.
they gave. You've said that you have removed the requirement that you get a referral from police. Madam, have you checked with your teachers? Because yesterday I was in Kakamega, and teachers knew I was coming for this meeting. And one of the issues they raised with me is that this thing called police, that we must get a referral, is eating us. And I have this teacher who is a victim of cancer. Chair, the lady went for medical treatment in Eldoret. She's from Matunda SA School. She went for treatment in Eldoret in a hospital. She was told to go to get a referral from police. Chair, you know, please, in Eldoret is on Comora building. She arrived there and she could not be seen for referral between 4 until 6 p.m. when these police people were able now to refer. By the time she was going for the doctor she wanted to review for the medicine, it was not there.
Thank you. Honorable Eva Bara, and then we come to Honorable Taitumu.
Thank you very
Follow
much,
up
Chair. Yes. On the question on why not a flat rate, I would propose that the TSC comes up with data on how much you pay each category, because we know that the lower the category, the lower the numbers, the lower the numbers, the higher the actual teachers on that level. So if you shared with us the data, then we'll be able to see the sustainability of the question of why not a flat rate. And that way, maybe then the members will be satisfied that it may not be, I'm not saying that it will, but we have to see those numbers to be able to come to that conclusion, whether it's possible or not possible. Thank you.
Honorable Eve, you know you are a member, you are not with the commission. Anyway, that's a good advice. But we also need to note that the younger the population, the lesser the ailments. You know that. The younger the population, the lesser the ailments. So this is an issue that we really need to look into. And I think so that we don't take all the time, members, we'll also still invite the commission. So the last one, Honorable Julius.
Thank you.
And then we'll finish this.
Mine is actually almost a proposal, because I know the CEO did not get me rightly when I raised the issue of maternity.
Order.
It's not a proposal. Actually, it's a question.
We don't need proposal.
I am guided.
Yes.
I want to say, when they will be coming, you have saying that we will meet the TSC at a later date, maybe with the help of the provider. We would like also to get the number of attendees in every category. For example, I know a teacher in job group D4, D5, D2, to reach to that grade, you must have served for a period of time. And these are teachers who are almost in the 50s and maybe almost 60s. And no teacher in that category is attending maternity issues. And you can see a lot of money is left in that category that can be used for other purposes. So we would like to see the attendees per every category or every service, whether it is dental, whether it is maternity, so that we can know where we rightfully need to take a lot of money.
Thank you. Let me have an honorable member for CIA. Introduce yourself. The next question, members.
Okay, thank you, Chair. My name is Dr. Christine Ombaka, CIA MP. Mine is a very simple question. What are the teachers saying is good for them? Did you seek their opinion so that they can participate in what is affecting them?
CEO, answer those questions. No, please. Let's proceed.
Thank you, Chair. Chair, I wanted to address the issue of the contract that has been raised by the member. Chair, the contract is a 3-year contract, renewable annually. The contract document has provided conditions which must be met by the service provider for the contract to be renewed. For the first year, we have paid the premium for the first year. We have not paid the entire 50-something billion that the member mentioned. One of the conditions for renewal of that contract is 1, performance of the contract. Number 2 is availability of funds, because we cannot foretell that the government of Kenya will give us money next year. And that even came to be a very protracted issue during contract negotiations, because we told them we don't even know the austerity measures that the government may come with. So one condition for the renewal of that contract is availability of funds. So no money has been paid for 3 years. Lastly, Chair, the complaints that teachers have raised, before this contract was renewed, the Commission itself did a survey.
And that is why we have provided in the contract, clause by clause, that there should not be, pre-authorization should not take more than 10 minutes. And it is a contractual agreement. We have a governance structure from the grassroots up to the headquarters that collects these complaints. And we have told our service provider, we will give you notice for termination if this complaint is not addressed within this period of time. So the majority of the complaints, remember we just signed this contract on 1st of November 2022. It is actually 2 months old. We accept and we know there were issues that were raised throughout the first contract. And those issues were addressed clause by clause. And that is why we shall avail to this committee the contract itself, so that we hold the people who are implementing this contract to account. And we have a CIT that is looking at all these complaints. What we have requested our teachers to do is to file a complaint if the services are not provided as agreed in the contract. Chair, issues of the implementation of contract are administrative issues. So that if a teacher is waiting for too long for pre-authorization, we have the administrative channels under which these things can be corrected. But what is all said and done, the teachers wanted, I'm addressing what Dr. Mbaka said, teachers demanded that we take them to NHIF. That was the demand for teachers. And they were saying NHIF is better than the one that we are providing. And the CEO and the commission sought for that very NHIF until we were told by National Treasury, don't ask for any other money. The government of the Republic of Kenya has given you money appropriated by Parliament. Use that money and procure a medical scheme for teachers. That is how we ended up in the tendering process. Thank you, Chair.
Yes.
Chair, sorry, let me just follow up before. Now, what was the wisdom of signing a 3-year contract and not a 1-year contract? What was the wisdom?
Yes, yes,
Chair, I answered that question before.
Answer it.
I said that it is a framed contract which is allowable, and it is to also save the TSC on time and money. But the caveat is there that, Chair, we will tell you that when we are doing this contract, the CEO almost never does anything else because of the numbers and everything concerned with that contract. And therefore, you do a framed, which is allowed when you have such a huge contract. It's allowed, it's huge. But you make sure then, and this also was the advice of the Attorney General, that you have a caveat to get out of this contract as easily as possible, and that is signed. And that's why, Chair, I'm saying, unless you see the contract and we go clause by clause so that you see what we are saying, maybe we'll keep talking and members will have their doubts, but it is there. And surely, Chair, if this
in the public portal,
it is in the
public
portal. Yeah, and I don't think also the AG would have. He is the government lawyer. He would have allowed us to get into such a huge contract if you cannot also get out of it that easily. You can walk out of this contract.
Point of order, Chair.
What's out of order on the Bonabi?
Chair, I don't think at this point, is it in order for the CEO to use the Attorney General as the arbiter of excuse when we are raising issues of performance of a contract we feel as the people's representative has issues?
Out of order, Honorable Nabi. I think by just invoking that letter, you know, the Attorney General in all government legal engagement is supposed to be the person of reference. Every government engagement. So in this case, he's just saying if it had issues, he would have actually been disqualified not to continue. So, remember, so that we don't continue with all this, we had agreed, I think the CEO, at one time, we discussed this issue alone, stand alone, so that we can be able to go to the bottom of it. Is that correct? Are we together? Because we have 3 more issues to go and the House sits in the afternoon. So the fact that certain issues are not being clarified, CEO, you can clarify the remaining issues, and then now we can agree on the time when we'll see you only under medical cover alone. Yes.
Thank you, Chair. I think Mr. Nyori answered most of the grievances that teachers raised. And Chair, every quarter we go, we have the governance committee that goes out to do a survey and it questions teachers on their, and that's how we even got to know that they want to go to NHIF. And that is how now we crafted the current contract arising from the feedback we got from the teachers. But Chair, I'm asking, can we be invited so that we come with that contract? We go page by page, we bring the letters of advisory from government agencies, and then members can, because I think even members also need to do a survey. How, for example, the police, how are they, I mean, their capitation, are they paid the same from the corporal to the highest person? Maybe we need to look at this in the public service. Thank you, Chair.
I think, members, that issue is settled, and I think we will inform the Commission that we are going to invite you, especially on the two issues, especially on that one issue of medical cover. We'll also invite the broker, the lead broker, so that he will be here. Let's go to the second question. CEO, proceed.
The next one, Chair, was about the recruitment of teachers. And at the para 2.1, engagement of teacher interns under the teacher internship policy and guidelines of 2019 while noting failure by the Commission to recruit 6,000 teacher interns in July 2022 despite budgetary provision. That is the question you asked us. So at the 2.11, we are saying that the engagement of teachers into internship program is governed by the internship policy and guidelines 2019 and is in line with the government policy to equip graduates with practical skills and competencies for the job market. And the teacher internship policy has the following 5 objectives, Chair, as you can see there, to provide structured and coordinated internship program for quality learning, job experience, and so on. Then to promote development and job competencies, to establish standards for an effective internship program, to identify supply channels for appropriate skills to the teaching service, and to establish a database for unemployed teachers who have undergone the internship program. So the teacher interns are required to serve for a period of 12 months, which may be extended as the Commission may deem fit. And since the inception of the teacher internship program in 2019, the Commission has engaged 28,300 teacher interns. In the financial year 2022-23, the Commission was allocated a budget to recruit 6,000 teacher interns to